Natural health present. 6 things you may not know about heart health. Your risk for heart disease and stroke might be higher than you think. Prevention is your best defense, so read on for information on risk factors, plus get tips on improving your chances of leading a long and heart-healthy life. 1. Heart disease is the leading cause of death in women. But according to the Heart and Stroke Foundation, only 1 in 8 women are aware of this. Heart disease was once thought of as a man's disease, but it's quickly becoming apparent that this isn't the case. The risk factors for women and men are similar, explains Dr. Beth Abramson, a cardiologist at Toronto's St. Michael's Hospital. They include high blood pressure, high cholesterol, diabetes, smoking, and family history of heart disease. However, women have some unique risks, including pregnancy and menopause. According to the Heart and Stroke Foundation, most Canadian women have at least 1 risk factor for heart disease. 50 to 80% of heart disease is preventable. It's never too late, or too early, to make a lifestyle change, says Dr. Abramson. Much of heart disease can be avoided by controlling risk factors. This includes having your blood pressure assessed by a medical professional. People think they can feel their own blood pressure, but this isn't the case, says Dr. Abramson. Speak to your doctor if you have any blood pressure concerns. Even if you don't have any apparent risk factors, it's important to know the warning signs of heart attacks and stroke. 3. Pregnancy and childbirth can increase a woman's chance of having a stroke. Most pregnant women in Canada are closely monitored for blood pressure changes and other pregnancy-related health risks. Strokes associated with pregnancy and childbirth are usually the result of an underlying problem, like a pre-existing blood vessel malformation or eclampsia. If you have or suspect you have either of these conditions, speak to your doctor about it before you conceived or immediately after finding out you're pregnant. The risk of a pregnancy-related stroke is greatest in the 6 weeks following childbirth, so don't skip postnatal appointments. Gestational diabetes can also contribute to heart health issues during pregnancy, so get assessed for that, too. 4. Hormonal birth control can increase some women's risk for heart disease. Contraceptives like the pill, the patch and the UVA ring are generally safe for most women. But those who smoke while using hormonal contraceptives put themselves at high risk for heart disease, high blood pressure and blood clots. If you smoke, talk to your doctor about safest form of birth control for you. And get help to kick that habit. Click through to learn how one Best Health reader found the inspiration to butt out for good. 5. Women's risk for heart disease rises after menopause. During the transition to menopause, which usually occurs around the age of 51, the ovaries stop producing the heart-protecting hormone estrogen. Also, menopausal women may experience an increase in LDL, bad cholesterol, and triglyceride levels, and a decrease in HDL, good cholesterol. Reduced estrogen levels can also increase body fat around the waist. It's the way the body handles fat across the belly that's the problem, says Dr. Abramson. Belly fat is associated with more inflammation and higher cholesterol. 6. Excessive alcohol consumption can affect your chances of getting heart disease. Drinking too much of any kind of alcohol raises blood pressure and increases your risk of heart disease and stroke. You may be surprised to learn that excessive alcohol consumption for women is classified as anything more than 2 drinks a day, and anything more than 9 drinks per week. There have been studies that show that moderate alcohol consumption can have a slight protective effect against heart disease, says Dr. Abramson. But most of those studies have been done on people who are already fit, and we don't recommend starting to drink if you don't already. Like plus subscribe.